7:23, and this can be a really tough time of year for our skin. We're getting into these cold weather days. Lindsay's been telling us about them all morning, so we need some help to keep our skin looking exactly as we want it to. Dr. Stephen Finical is here from Charlotte Plastic Surgery. Good to see you.
Good to see you.
We're excited to have you here because this is something a lot of people struggle with as we go into the winter months. Our skin just sort of changes completely.
Well, a lot of dry heat out there, a lot of warm areas, and not a lot of humidity. So we end up dry and warm, and our skin really dries out. So the foundation to any good skincare is going to be a good cleanser, a moisturizer, and then a sunscreen. This time of year, we're really concentrating on the moisturizer. That's the area you really want to push.
Do we still need sunscreen at this time of year?
Absolutely. Even though daylight savings time makes you think you're saving yourself from daylight, you're really not. There's plenty of sunshine out there. If you were to go to the Panther game tomorrow, ideally, you'd want to put sunscreen on before you go, 20 minutes ahead. You'd want to reapply when the game starts at kickoff, and then you want to reapply at halftime. Every 80 minutes, and people miss that. They'll put it on in the morning and forget about it. And that really is the importance of sunscreen, is maintaining and reapplying.
Do we have to change our moisturizer from summer to winter?
You don't necessarily have to if you have a good moisturizer, but evaluate your skin and see how your skin is doing, and then you can change accordingly. One of the great things we have at Charlotte Plastic Surgery is a new Visia concept. It's an imager. It'll take your picture, it'll filter different things out so you can see wrinkles, you can see sun damage and those kind of things, and then using that technology we can tailor treatments to you. Yeah,
we're looking at some of those images here. I'm going to be honest, I did this recently. I was appalled at what I saw, but it was really helpful to know what's happening. Talk about what some of those images are.
When you filter through, and the bottom left corner is just simply ultraviolet light. The one next to it is just the brown spot filter, and then the red spots. And you see all those things, and you look at that lady's skin, and you can obviously see that she has very good skin. But when we filter out those things, we can really see where there's been some sun damage, some aging process, and things like that, and it tailors the treatment. Obviously, a great communication tool for the practitioner and the patient, but also kind of a place to start and what to work on, and it really is helpful. Yeah,
I found from my photos that I had a little bit more red than I thought I did. Are there procedures that you can then go through to kind of eliminate some of those things?
Well, this time of year is certainly popular for procedures because you're going to have some downtime and you're going to be out of the sun. But laser resurfacing, BBL, which is broadband light to get rid of brown spots, those are very popular this time of year to do those things.
Expensive?
Well, it's all relative. I mean, think of it this way. You buy a new car, you leave it in the parking lot. Your face you get to take with you most everywhere, so it's worth the investment.
I like the way you think. I like that. And let's talk about products, because you can spend a lot or a little on products, but sometimes if you spend more, you're going to get more for your money.
Well, we go with things that have science. We really looked at product lines that have something behind them, more than just a cold cream with a good smell. I mean, you really want something that's going to do something for your skin. Good cleanser. This is an alpha hydroxy, beta hydroxy cleanser. Means it's got some fruit acid in it, really scrubs off the skin very, very well. This is one, leave that in the shower, wash your face with it each morning or every other morning because it is kind of harsh.
That's exactly what I do. Actually, I use this and I have it in the shower and I just use it every other day.
Yeah, it really is. It's nice because your skin, when you come out, really feels clean, and then products absorb. Now, this is the one that I can't live without. This is the TNS Essential Serum. It's actually a double pump kind of a product where it comes out and there's growth factors and antioxidants in the same treatment. So when you're putting that on, you're getting the benefit of growth factors, which actually, and we have the science behind it, actually thickens your skin, so it makes it healthier. And then the antioxidants are for protection. And then the final thing, of course, after you've moisturized, is a good sunscreen. This one happens to be a new one, and I brought it because it has some anti-aging properties built into it. It protects against infrared as well as UV light. You know, when the UV, you talk about UVA and UVB, is only 7% of the sun's energy that reaches Earth. Over 50% is infrared, and that protects against infrared energy. So it's really something new.
There is so much to think about and so many options out there. I put some more things that Dr. Finical didn't even get to on our website, WBTV.com. It should be there right now if you want to go check it out. Good to see you.
Good to see you.
We hope to see you soon. Let's all take care of ourselves during the winter months. It's 7:28. We'll be right back after.